mynews.studio.
Picture this. A vaccination team makes it to a remote village just in time. Can something as routine as a shot really change millions of lives?
Today's date is December 5th, 2025. Let's look at the bigger picture for a moment. Recent global data shows that measles vaccination has prevented tens of millions of child deaths since the early 2000s. And these aren't just estimates. These are actual lives, tracked and counted.
It really is hard to overstate. Measles used to claim hundreds of thousands of children every single year. But with large-scale vaccination campaigns, those numbers have plummeted. How did we get from there to here? What changed to make this dramatic drop possible?
The main driver is high immunization coverage. When enough children get both recommended doses, outbreaks become rare and deaths drop sharply. But if coverage falls, even a little, measles can come back quickly. We've seen this happen when vaccination rates dip.
Right, and those reversals remind us progress doesn't guarantee permanence. There are still regions, especially parts of Africa and the Eastern Mediterranean, where big outbreaks happen. The reasons can vary. Sometimes conflict disrupts health systems, or funding falls short, or the aftershocks of COVID-19 make reaching kids even harder. And then there are just the simple logistical challenges of serving isolated communities.
But even in countries with plenty of resources, we're seeing measles return. Is vaccine hesitancy the main reason there?
That's right. In places like Europe and North America, misinformation often spread online has led some parents to delay or refuse vaccines. The result is local outbreaks, even where clinics are easy to reach. It really highlights how much trust and good communication matter, alongside just having enough doses.
So how do we address this? Is it just about running more big vaccination campaigns, or is there something else needed?
Mass campaigns play a role, but they're not the full answer. The real foundation is strong, routine primary care. When families can consistently access regular immunizations, coverage stays high. But when systems are weak, kids slip through the cracks, especially those far from clinics. Remember that story from the Philippines, where a health worker crossed rivers just to reach one isolated family.
That image really sticks, a single health worker going to such lengths. But it also shows the limits. We can't rely only on individual heroics. What about policies? What can governments and organizations actually do?
Long-term investment is key. Consistent funding, proper training for health workers, keeping vaccines cold along the way, and maybe most important, real engagement with communities. When people understand how vaccines protect their own children, participation rises. The global push against measles has proved this. While the disease isn't gone everywhere, it's gone from a leading child killer to something much more manageable.
And these lessons, they're not just for measles, right? Can this approach help tackle other diseases too?
Definitely. The strategies that work for measles, coordination, communication, and steady investment, are crucial for fighting polio, pneumonia, HPV, and even preparing for new pandemics. It's less about one disease and more about building health systems that can cope with whatever comes next.
So let's bring this back to today. With all the ongoing debates about vaccines, especially after COVID-19, what's at risk if we start lowering our guard now?
The risks are real and immediate. Measles is incredibly contagious. Miss just a few vaccinations, and outbreaks can escalate quickly. All our progress could disappear much faster than we think. But we do know what works, and the evidence is right in front of us. Millions of lives already saved.
For any parents listening, the takeaway is simple. Vaccines work. They're the reason so many children are healthy and alive today.
Absolutely. Behind every data point is a real child who got a shot and got to grow up. That's something worth holding on to.
Today, we've looked at how global cooperation and actions on the ground have changed the future for millions of children.
Thank you for joining us as we explored why measles vaccination is both a hopeful story and a reminder to stay vigilant. Stay informed, stay engaged.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.